Hey guys, today I want to talk about shoulder injury prevention. This video is going to serve as an overview of several different areas of the shoulder that we tend to look at first when addressing shoulder injury prevention. If you currently have shoulder pain, it's important to make an appointment with your physician or with your physical therapist to develop a customized treatment program. So the following videos after this one will explain in depth a couple of my go-to exercises for strength and flexibility of several different areas relating to the shoulder, and specifically shoulder range of motion and strength. So I have a shoulder model here with me. You can see here we have the back side of the shoulder. Here's the shoulder blade. This is the upper arm bone. When you reach overhead, this shoulder blade is going to rotate upwards, accounting for about 1/3 of the total overhead motion. This ball and socket joint, the glenohumeral joint, is going to rotate upward and account for about 120 degrees of motion. So it's important that we strengthen the muscles that attach to the shoulder blade, as well as strengthen the muscles that attach to the ball and socket joint to make the most out of our range of motion and increase the stability in the shoulder. The muscles that attach to the shoulder blade, your scapular stabilizing muscles, there's a couple of exercises that we'll get into to look at how to best strengthen those. Another common area to address are your rotator cuff muscles. So these are the muscles right here that attach from the shoulder blade, and then they go in and attach to this head of the humerus, the ball and socket joint. The shoulder has a lot of mobility, but it doesn't have as much inherent stability. So a lot of times in preventing injuries, we really want to increase the stability of the shoulder joint. There's a couple other areas that we don't typically think of with preventing shoulder injuries. One of those is the length of the muscles on the front of your shoulder. We want to make sure that those are stretched out appropriately. So we'll look at an exercise for that. Another area is your upper middle back, your thoracic spine. If you don't have proper extension of that area of your upper middle back, then you're not going to be able to lift your arm completely overhead. So those are some of the areas that we'll address in preventing shoulder injuries. But like I said before, if you currently have shoulder pain, go ahead and contact your physician or your physical therapist so they can begin to develop a customized treatment plan. Thanks. For more exercise tips and additional information, you can go to our website at stepandspine.com.